Okay, we need a show. Dr. Gerard. And is everyone ready? Yeah. Well, good morning. We're bringing our Queensland COVID update to you live from our latest pop-up vaccination clinic right here on platform 3 at Roma Street Station. I want to thank Queensland Rail for everything they're doing to help us get people vaccinated. I want to thank the Rail, Tram and Bus Union, who I know have also been really supportive of getting the QR workforce vaccinated as quickly as we can. It's also a chance to get the message out that commuting by train is safe, and we want to get people back on public transport. So this is your chance to get on the vaccination train. It's your chance to catch the express to COVID freedom. Don't walk past the chance to get vaccinated. We're doing everything we can to make vaccination, double vaccination, and now booster vaccination as easy and convenient as we possibly can. In Queensland today, we're reporting 86 new cases of COVID-19, which continues that general trend of a doubling in cases every second day. We now have 2,428 total cases, 269 of those are active, 2,146 recovered, 61 cases confirmed of the Omicron variant. Of those active cases, 75 are currently inpatients, that is being treated in hospital, and one is in intensive care. We're also announcing today a change to the quarantine requirements for double vaccinated close contacts of positive COVID cases. Until now, those close contacts have been required to quarantine for 14 days. From the 22nd, we will bring forward the reduction in that quarantine period from 14 to 7 days. That will greatly reduce the impact on individuals as well as on businesses when they have a COVID positive case. Currently, all of those close contacts go into quarantine for 14 days, which can have a dramatic impact, as you'd understand, on operations and on businesses. Reducing that to 7 days reduces the impact on those individuals, as well as allowing businesses to get back up and running again. I'll ask the Chief Health Officer to provide more details. We have the Police Commissioner as well as the Acting CEO of Queensland Rail available for you also.
Thank you very much, Deputy Premier. So today in Queensland we have 86 new cases to report. That continues the expected doubling trend every 48 hours. This is a trend that's been seen in a number of countries around the world. That's that very fast rate of transmission of this new variant, the Omicron strain. This brings the Queensland total to 2,428 cases since the beginning of the pandemic. 269 cases are currently active. The vast majority of our patients have minimal symptoms. We have one patient who has been placed in an intensive care unit as a precaution. I've spoken with the doctors looking after this patient. She is only moderately unwell. She has a number of other medical conditions, and that is the main reason she is in intensive care unit. She received vaccination about 6 months ago, but the main reason for admitting her is because of her other medical conditions. So the vast majority of patients that we have been seeing have had mild symptoms. So there have been 34,518 COVID-19 tests completed yesterday. Queensland Health administered 13,654 vaccinations yesterday, and more than half of these, 8,187 doses, were third doses, and that's what we really want to see. We want to see people step up and get their third dose after that 5-month period, because we know that protects you against the Omicron strain. 84.7% of Queenslanders more than 16 years old are fully vaccinated, and 89.77% have received at least one dose. But we expect to hit the 90% first dose mark when the Commonwealth reports this issue later this afternoon. So as you've heard from the Deputy Premier, for fully vaccinated close contacts of COVID-19 patients, the quarantine period will be halved from 14 days to 7 days from tomorrow, from 14 days to 7 days from tomorrow. That is consistent with our national guidelines. They'll need to get a test on day 0 and on day 5 of the quarantine period, and also if they get any symptoms. For those individuals who are unvaccinated, the quarantine period continues the same. It will be 14 days as before. That will not be reduced if you are unvaccinated. This is consistent with the national guidelines. Just to be clear, we have been planning this now for a while. The national guidelines suggested a 14-day quarantine period in states which were in an exclusion phase. As we move forward and we are seeing more community transmission, and also now that we've reached a high level of vaccination in Queensland, we are joining with the other states in the national standard of a 7-day quarantine period for double vaccinated patients who come into contact with COVID-19 cases. The sources of acquisition, of the 86 reported cases in the last 24 hours, 67 cases are under investigation. Only one case was overseas acquired, 6 are linked to interstate travel, and 12 are contacts of known cases. As before, the locations where Queenslanders have acquired infection is very widespread. I have one new location to mention, that is Central Queensland in the town of Emerald. So that's the first report from Emerald now we've seen in Queensland. So you can assume that this virus is widespread across Queensland. We have 61 confirmed cases of Omicron virus in Queensland, and we're seeing about 2 cases of Omicron diagnosed for every 1 case of Delta. So Omicron has become the dominant virus here in Queensland. There are 75 cases in hospital, but most of these patients are in there for quarantine reasons, and we are developing processes to get these patients out, and that is continuing in the coming days. We're getting more and more of these patients out of hospital that are not there for non-medical reasons. So there are 70 cases currently being cared for in their home or in other suitable residence. Thank you very much.
Good morning, everyone. I'll just start with a few stats and we'll go from there. Since we reached the 80% requirement last Monday at 1 a.m, there has been 225,788 GB applications made for those passes, and 1,609 for IR, which is the International Home Quarantine. What we are seeing is a lot of people coming to the border by road and air without the requirement of having a negative PCR test in the last 72 hours. The number of vehicles that came through yesterday in the last 24 hours was 36,271, and of those, 325 were turned around. 1,637 heavy vehicles, 16 turned around. 188 flights from a hotspot, 8,800 passengers confirmed checks, and of those, 14 refused entry and 107 into hotel quarantine. The requirement is it has to be a negative PCR test within 72 hours of coming into Queensland. We are seeing people actually flout this at the moment. So the strong message is that if you don't have that negative PCR test, you will be turned around. We have taken a compassionate approach in extreme cases and placed people in quarantine. However, what we're seeing is some people aren't making a genuine effort to get the PCR test and wait for that required period to get the test back and then come into Queensland. Again, we've seen a number of people obviously failing to comply with the COVID health direction, and in terms of wearing masks when they're required and being asked to do so, and also trying to get into premises whilst unvaccinated. As a result, there have been 1 arrest and 4 infringement notices. Thank you, and I'll wait for questions.
Good morning, everyone, and welcome to our Roma Street Station pop-up clinic. This is the second one of these clinics, and we are delighted to welcome our employees, their families, commuters, as well as many from our community. Now, this clinic would only be possible with support from Queensland Health, so thank you to Queensland Health, and also an idea from our employees. So what I would encourage everyone is seize this opportunity. We will be here until 2 p.m. today, and there'll be many others open in January. Now, many of our employees are out there getting their boosters, and I'm hoping to be joining them as well, so please do so if you can. Thank you.
Dr. Gerard, with this new quarantine decision with your vaccinated, can you sort of set us up what happens with international travellers? Can they leave quarantine after 7 days as well?
We are looking at that issue at the moment. We have not made a call on that yet.
And does today's numbers surpass previous records for Queensland study?
That is correct. This is the highest number of cases reported in a 24-hour period in Queensland.
South Australia's just ditched the requirement for testing on arrival for travellers. Why not do away with the 5-day test? It seems not many people are doing it, and also there's a lot of strain on testing centres. Why not just remove that?
Well, there are 3 measures we are taking in order to slow the transmission of the virus in Queensland, or three key measures. The reason we're trying to do this, we're trying to slow the spread of the virus is firstly to reduce the strain on the hospitals, and secondly to allow people to get their 3rd dose of vaccine, particularly those that are vulnerable. The measures that we are taking are obviously vaccination, the increased mask wearing, and it's fantastic to see everybody wearing masks, and also reducing seating events, which we know that seating events introduced from outside are associated with an increased rate of transmission of the virus when they occur. So that is the rationale behind the policy of screening visitors.
So it doesn't seem to be very successful. I mean, a few people seem to be doing it based on the numbers, and also there's 4-hour, 5-hour waits in testing clinics.
As with all of these things, we review these measures on a daily basis.
Doctor, do you have an update on the convention centre from the record graduations?
I don't think I have. No, I don't have that here. I'm sorry, not be able to get that to you. Not large ones that I'm aware of, but there are lots of small ones. There are lots of small clusters that we don't report, and that's going to continue. There is a prediction, and I can't remember the date. It's sometime in the first half of January.
There seems to be 2 approaches to the 2 graduation ceremonies. 2,600 Griffith grads have had to isolate until they get their test results back.
Yes.
Or in Townsville, they have to isolate for the full 2 weeks. Why are the 2 different approaches? Some grads up there have to be there.
The ones that were identified in Townsville will have been identified as close contacts, as opposed to the ones locally would have been casual, not close contacts. So I wasn't involved in the contact tracing, but that will have been the rationale.
Close contacts in Queensland is for 15 minutes, right?
As a general principle, 15 minutes face to face.
In other states, it's the same room for 4 hours. Why the big fluctuation? You're talking about adopting national guidelines earlier. Why doesn't that apply in this case?
The standards are pretty clear across the country.
It's 4 hours, for example.
I'm not familiar with those differences, I'm afraid, sorry.
Are you expecting any major changes out of national cabinet in Queensland or have to adhere to?
I don't know. I'm looking forward with interest to see what comes out of National Cabinet. I think that will be an interesting meeting.
Just to the 75 cases in hospital,
Yes.
are any of them actually required to be there for medical purposes?
There aren't many, to be honest, other than the one. There's the one I mentioned yesterday, that an unvaccinated woman. There's the one that is intensive care, but mainly for precautionary purposes. But there are lots of other reasons why people need to be in hospital. They might be elderly, or they might be the child of someone who's immunosuppressed, or of someone who's immunosuppressed. They might be a traveller, for example, so tourist. And we are establishing systems for getting these people out of hospital. That is probably one of our biggest priorities at the moment, to establish these mechanisms for getting these remaining patients out of hospital, to clear beds for sick people as we expect them to arrive in hospital. Because even though we haven't seen many sick people yet, we do expect and we are planning to see sick people. We hope for the best but plan for the worst.
And the 75, just big, it's not 75 of the 86, it's 75 in total for all the cases.
No, that's 75 in hospital at present. That's all cases. That's not 75 of the 86.
And in terms of that law, in terms of training, do you have upgraded modelling in terms of the employment and how hospitals do
There is modelling which is being produced now. It's coming out. I can tell you that you can do the maths yourself. If we double the cases every 48 hours, we will expect thousands of cases in January. We know that. We can do the maths ourselves. But there will be some modelling. There is some modelling being produced now. But
Are there plans to ramp up the resources and testing sites given the strength of them already? Like, are you going to extend out because there are these
I'm trying to think. There are so many meetings looking at these various issues, and I wasn't at the latest testing meeting. They certainly are. They're ramping up a lot of things at the moment. So testing, vaccination, etc. So I cannot answer your question specifically.
Can I just ask the Commissioner, how many police are currently in isolation? If there's an update from, I think it's yesterday.
Yes, there is. Thank you. So there's seven police now with COVID, and there is 111 police officers in quarantine and 4 staff officers. I welcome the 7-day quarantine directive because most of my staff, as you know, are double vaxxed, and in fact nearly every one of them because of the compulsory vaccination program that we have in place. So some of those officers will be back out on the streets in the next couple of days. We have a very good contingencies in place. We've all enacted our business continuity plans. There's additional resources from those districts as well as Central Command, so I'm extraordinarily comfortable that everything is being covered where it needs to be, but certainly from a frontline operational perspective, extraordinarily good news that only 7 days quarantine is required for those close contacts.
Are any other stations closed aside being Lee?
So Beanley is being covered by other stations, but certainly no other stations are affected at this stage.
Minister, if I could just ask you, we've been sent lots of letters that the government's received from business owners who had to isolate for 14 days. They lost a lot of money. Did all of this play into this decision making?
Look, obviously that's a consideration. The impact of every decision, its benefits and impacts are weighed, and in this case the Chief Health Officer has been able to provide the advice that given our current risk settings and what we're seeing in terms of the incubation period of the virus, that we can relatively safely move to 7 days quarantine for close contacts.
Has it been hard for those business owners who have had to isolate, no income?
It clearly has had an impact, and that's one of the matters that is considered, that is weighed by the health advisors when they provide this advice. We've obviously experienced it ourselves too. You've heard from the Police Commissioner. It has an impact on hospitals, on the ambulance service, so we understand that the impact these settings have on operations, and that's been taken into account in bringing down and bringing forward the reduction in the quarantine period for close contacts.
Dr. Miles, an infectious diseases expert, Paul Griffin yesterday agreed with Dr. Gerard in terms of saying the day 5 COVID test was not the most important thing. We've got double vaccine before they leave. So who do we believe, the Health Minister or his two learned colleagues? She says it is important. 2 weeks ago she said the important thing is this day 5 COVID test, but Ben said earlier it doesn't seem to be effective at all in terms of its enforcement, to say the least. Not one fine issued yet. Are people taking it seriously?
Well, look, all of the measures that we have in place are based on the health advice. They all cumulatively provide the public health measures that we are currently using to manage the increase in case rates, and we'll continue to take that health advice. Currently, that health advice requires a PCR test at day 5.
Minister, interstate, it's almost impossible for people to get a test. People are waiting for 9 hours in queues. Is the Queensland border effectively closed for people who can't get their negative test before they come up?
Well, I think you're well aware it's not effectively closed. Many people are coming here. The Police Commissioner just outlined how we've issued 235,000 border passes. That is hundreds of thousands of people coming here from hotspot states. So that doesn't include people coming from states where they don't need those border passes.
Would you consider extending the 72 hours to allow people to get those negative tests?
Well, again, that would be based on the health advice, and I'm happy for you to put that question to the Chief Health Officer, but the 72 hours is based on the current experience of the incubation period of the virus.
Given our cases are doubling every 48 hours, we're sort of accepting of that. When do we get to a point where borders and checkpoints and border passes become somewhat redundant?
Well, they're doubling at that rate with all of those measures in place. So if you reduce the measures, then the doubling rate shortens. The rate of increase goes up. And so they're the measures we have in place now, and the result of those measures is a doubling rate every 2 days.
So how many of those people who travelled from the hotspots, ACT, New South Wales, Victoria, Queensland, had tested positive for COVID on day 5?
I don't have that done.
Can we ask the health? Can we ask the Chief Health Officer?
I'm not sure it gets broken down.
So no one knows? No.
Minister, yesterday we had reports of people being turned away from long queues of vaccination hubs, but there's no supply issues at all.
I'm not aware of any supply issues, no. There's certainly no queue here at platform 3 of Roma Street Station.
Are you worried though about big crowds, people might be getting worried and rushing out to get their boosters and things?
Well, I hope people do rush out to get their boosters and things. That's exactly what we want. The more people we can get triple vaccinated, the safer they'll be from the current variant of the virus.
Mr Miles, Dr Miles, the Premier yesterday appealed for people coming in Queensland to go and get that day 5 test. Obviously she's concerned the numbers are low, but what is the number of people who tested positive? Queensland is keen to know that, given the assurances of protection that the Premier and the Health Minister gave them 2 weeks ago when announcing the border would reopen. I think Queenslanders are keen to know the extent of the threat from those people who have travelled from hotspots. Is that a fair enough expectation from them?
Well, I think it's not unreasonable for Queenslanders to expect that people coming into our state meet the requirements of their border pass. You just remember that it wasn't that long ago these people couldn't come to Queensland at all. Now they can, and they are coming in their hundreds of thousands. And one of the measures we've put in place to keep Queenslanders safe is that PCR test.
But it's reasonable though to know the effectiveness of those measures, isn't it?
Well, it's reasonable to know that we've put them in place. It's reasonable to know that we've put them in place based on the health advice, and we'll continue to take the health advice.
You can't provide any reassurance, by the way, of the number of positive tests from those people travelling.
Well, we don't break those tests down that way, but I know that many people are getting their day 5 test. I got a COVID test on Saturday, and the person in the queue next to me was getting their day 5 test. They come from Sydney.
Anecdotal stuff you've got. Just anecdotal stuff.
Same as yours. Anyone else? Thank you.
Thanks.
Thank you.